So a little bit about myself. Like I said, my name is Jerry George. I received my Bachelor's of Science degree at Loyola University, Chicago. I did get my master's degree of science at Nova Southeastern University in occupational therapy. I have about 15 years experience in the field. I have worked in independent living facilities, assisted living facilities, home health care, skilled nursing facilities, and now I am the director of operations, like I mentioned, for our outpatient sites for outpatient therapy. So enough about me. Let's jump into the topic. So we're going to discuss about falls. Falls is something that affects not only older adults, but anyone of any age. Like falls can happen at any time. 1 in 3 adults have a fall, who are over the age of 65. But, we're not saying, okay, most people fall when they're older. A fall can happen to anyone. I myself have 3 small children, 7, 5, and 2, and their toys are everywhere. And a few weeks ago, in the middle of the night, I went to go get my daughter who was crying, stepped on a toy, and I fell. So, falls can happen to anyone at any time. So, and today we're here to learn about how to prevent falls from happening. But, we can do as much as we can, but, some falls are just not preventable. So we're going to teach ways how to, strengthen our muscles, strengthen and work on our balance, right? To really help us avoid falling in some scenarios. About 40% of hospital admissions are due to a fall. And like I said, each year, about 1 in 3 adults over the age of 65 fall in the community. And that rate goes up to 50% as we age 80 and above, right? So you have a 1 in 2 chance of falling if you're 80 years old or higher, right? So, and older adults discharged from a hospital due to a fall are 50% more likely to experience another fall within that first 6 months. And we kind of see it in our line of work where when patients go to the hospital, their routines have been interrupted. Their everyday activities have been interrupted. You're in the hospital, you're laying in bed usually, right? The hospital you're not getting your usual steps in. So people tend to decline, and then they get home and they're in that weakened state. And if they don't get the therapy, home health care, outpatient therapy, we tend to see people fall more often. So therapy post-fall is very important, and that's what the research is showing. Nearly 87% of all fractures are a direct result from a fall. So, falls can be detrimental. You can break something, you can hit your head, and you can have a brain bleed. So there are high consequences to falling. So it is a very important topic that, I feel that we need to educate ourselves, our community about, because it is very prevalent. So the average healthcare cost for a fall, this is nationwide. They took this data nationwide and they came up with, it costs the healthcare system about $11,000 per person who has sustained a fall. So some could be more, due to surgery and things like that. Some could be less, they just kind of took a national average. Of those who were hospitalized for a fall, nearly 50% of them never return home. So that means that post fall, they're not able to get back home and live home alone or live at home in their current conditions. They may have stairs or other barriers. So they end up transitioning to another living arrangement, whether it be independent living, assisted living, supportive living, moving in with family. So they're, 50% do not return back to their normal, right, residence. And falls cost about $754 million a year to the healthcare system. So, quite costly, and it's very prevalent. So we're going to discuss, where do falls most likely take place. I'm sure you can guess, the bathroom and the bedroom are kind of the key places where people sustain a fall. Stairs and the kitchen are the next culprits. So we'll focus on what factors play into this risk factor. So if you're on oxygen, that tubing, right? We see it's very long, it's on the floor, and there's no good way to kind of, keep that out of, your walking surfaces and walkways. So we see a lot of people get tangled up in their oxygen tubing and fall. Small pets, right? When we have our loyal companions, they're kind of running around. We may misstep and unfortunately step on one of their tails and fall. So and I've seen it happen. Firsthand experience when I was doing home health, where luckily I was there to catch the patient, but she did step on her dog's tail. The dogs got startled. She got startled, and I was able to catch her because I was right there, but it does happen. Inadequate lighting, right? So we want to make sure, especially in home health, when we go, we do what's called a home assessment, where we kind of just take a look at risk factors and barriers and make recommendations. And that's one of the biggest recommendations I like to make, because something simple as lighting can be a small modification that can help you, and it can go a long way to prevent you from falling. Changes in floor surfaces. This is when we see, carpet, tile, hardwood, whatever the case may be. We want to be very careful. I always, with my patients, I always stress, you have to remember, we're going from one surface to other, especially if you have some sort of assistive device, a walker, a wheelchair, a cane. You really want to be cognizant of those changes in the flooring. Slippery floor surfaces. What I mean by this is, a lot of people have rugs, throw rugs that kind of get tangled and caught. So we always recommend removing those type of obstacles, because you don't need something extra to be in your way, right? And potentially cause a fall. Stairs. When I put the word tricky here, I always, stress, is there handles? Are they far apart? Are they high in length, right? And I always recommend, when I have patients and they plan an outing, right? We are moving out of winter and into the spring, and summer's coming, and people want to be out and about, right? So I always say, do your homework. If you're going to go meet your family for a restaurant or things like that, during the warmer climate, I always call the restaurant, ask if there are stairs, ask if it's accessible, kind of plan out the logistics of your trip beforehand, because that could save you a lot of headache and could prevent you from falling. I had a patient who, she didn't realize there was a curb that she had to step onto. This was downtown Chicago, and she was trying to do the curb. She had her family there. Despite family being there, she still fell. And it was a whole, she had to wait for the ambulance. She had to go to the hospital. She lives in the suburbs. She was taken to the local hospital. So, it was a big ordeal. So really try to do your homework and see if these places are accessible. I'm guilty of this next one, clutter. I like to keep everything I buy, I like to keep, right? Just because I'm going to use it one day. So my wife tells me that, I have a problem. I'm like one of those on those TV shows. I don't know if you've seen Hoarders. My basement is full of junk. So I admit it. I have a lot of clutter that, for a living, I go to other people's homes and I say, hey, have you thought about, getting rid of some of this stuff, these obstacles that are in the way? So it's kind of funny, but it's true because, the more clutter we have, walkways are crowded. You have to work a little bit harder, right? And if you've just spent time in the hospital, you're already weak, your balance is decreased, right? So you want as much space and the least amount of clutter as possible. And then tripping hazards, like I discussed, toys, that's for me. Throw rugs, cords, tubing. You want to really kind of take a second look and see where you can move things around so you have clear walkways. So with the bathroom and the kitchen, non-skid mats are the first thing I recommend because, of course,
Barry,
yes.
can you answer the one question before you move on, that's in the chat?
Sorry, let me.
It says, why does a hip fracture older person so often lead to them going downhill so quickly?
So typically, what we see from a therapy standpoint, right, is one, healing. As we're older, it's harder to heal. So you may or may not heal at 100%. Also, the muscles around that area are deconditioned, right? And they may never get back up to 100%. So that's why we see all this deconditioning that a hip fracture can easily take someone down from being independent to now needing supervision, now needing assistance. And everyone heals differently, right? No two people heal the same. So there's no magic algorithm or calculation like, okay, you're this XYZ, you're this age, you're this gender, you're this diagnosis, you'll heal within. If you speak to physicians and orthopedic surgeons, they always give you a range because no one can essentially lock down a time frame. But it is due to, as we age, osteopenia happens, right? This is loss of bone mass. Your bones are not as strong as they were when you were 50 or 40, right? And then there's a phenomenon called sarcopenia. If you take anything away from this Zoom meeting, I want you guys to just take this really into heart. Sarcopenia, you can look it up on the internet. It is basically the loss of muscle mass. As you turn 40 years old, I just turned 40 in December of last year. So it doubles. And as you turn 80, it triples. So as we age, we are having more and more muscle mass loss, right? So that is an issue. How can we combat that? We're going to talk about that. But I hope that helped answer the question. Also, one more thing I would like to add. A new protocol that orthopedic surgeons are doing, if you are electing to do a hip surgery, knee surgery, they are, especially locally, Midwest Orthopedics, who works with Rush, their protocol is to provide 2 to 4 weeks of therapy prior and then therapy post-surgery, because they're finding that people are healing faster when the muscles around the area are strengthened before the surgery. So people are having faster recoveries. So that all ties into what I'm going to talk about with therapy, exercise, because this is very important. All right. And yeah, please go ahead, keep at, sorry, Jody, just let me know if there's any other questions, but go ahead, ask your questions in the chat. No problem. Sorry, I think I went backwards. Okay. So like we said, the one thing that I always recommend is the non-skid mats, right? Because bathrooms, what are they notorious for? Being wet, right? Being damp, especially if you take showers, right? So also in the kitchen, if you're cooking, right? Chances are there's going to be water somewhere. So you want to make sure you have non-skid where if you're going to step on it, it's going to stay in place. Also, I always recommend, especially my orthopedic patients that have had surgery that want to take, a bath. I always recommend putting towels down, right? Just in the beginning, just so you can get used to, because you don't want a wet floor or a wet anything, any type of surface, and then take a tumble post surgery, because that's just going to delay your rehabilitation, right? So, and then random ice cubes. Now that the weather is starting to slowly look, the weather was beautiful yesterday here locally. It's going to start getting better and better. People are going to drink ice. I've had some patients that, now we have the fridges. We just, take our cup, put it. Sometimes the ice slips, and now you have a water spot. We've seen patients fall like that. So you want to make sure, be careful when you're getting ice, especially I know in the winter, we're not doing that, but in the warmer months to come. Bedroom, removing clutter. What usually happens at 3 o'clock in the morning? Typically nature calls. We get up from our sleep and we try to go to the bathroom. So we want to make sure that clutter is cleared. We have a clear pathway to the bathroom, wherever that may be. One thing that I suggest, especially post-surgery, I always say, hey, keep a commode on hand in the beginning. And as you get stronger, your balance gets better, then you won't have to use it. But in the interim, I always say it's something simple and easy that could help prevent a fall, right? And complications to your journey of healing. And then keeping items, bedside within reach, right? Everyone should have their phone, right? In case of an emergency. A lot of people have the life alerts. It should be within reach, just in case there is a medical emergency going on. And then stairs. We talked about this a little bit. If there's no handrails, have a plan in place. And then if the steps are narrow, big, just kind of calling ahead of time if you are going somewhere where there are stairs. Because, some people do stairs no problem. Others have a problem. I'd rather have everyone be logistically on top of it and savvy and do your due diligence before going out into the community, because that is a big place where people fall. Some of the physical issues that we encounter that increase your risk of falling. Number one is incontinence, right? Like I said, when nature calls, we don't say, hey, I could wait another hour or two. No, when nature calls, you go, right? So that's one of the biggest things, rushing to the bathroom, right? To get to the bathroom on time. We see people fall because they're rushing. So that's where I said that commode might come into place, if you really need to go in the middle of the night. Dementia, we're seeing this more and more often as we age. There are more and more people diagnosed with dementia. And that's definitely where, we're not safety-wise 100%. So that can cause falls, right? With dementia, we have memory issues, kind of cognitive imbalances. So that could cause issues where we tend to see patients with dementia who have increased risk of falls. Decreased sensation, proprioception, right? Especially with diabetics. This is where you have like that loss of sensation in your feet, in your hands. and people fall because of this. Sensory impairments, this is like vision issues, hearing issues, especially vision. Our vision as we age does tend to decrease over time, right? So, one thing I always recommend is please see your optometrist, ophthalmologist, check your vision um, every year, right? Just to make sure and see if there's anything that can help with your vision, right? Because vision is one of it's the window to the world, right? Your eyes are the window to the world. So you really need your vision, right? And if you have lower vision or decreased vision, you want to see if there's anything that can help. Hearing, right, is also another thing that kind of goes along with vision. Normal changes with aging are slower reflexes. We talked about sarcopenia, magic word of the day, sarcopenia. Look it up. Really kind of get a feel for what that is because it's a phenomenon that happens to everyone. No one is excluded in this. And then disease related things like blood pressure, diabetes. One thing that we see, dehydration. A lot of people go out to the hospital because they're not hydrated. So we want to make sure that we're drinking enough water, but that has a caveat. We want to make sure that, then the incontinence happens, right? Where we have nature calls, we got to go. So you want to kind of limit your water intake 2, 3 hours before bed at the very minimum. But throughout the day, we need to make sure that we're drinking enough water. Another thing is like shortness of breath and medication side effects. I always when I always ask the question, when are you going to see your doctor next? A lot of people just go to the doctor, kind of talk to them for a few minutes and leave without really getting all the information that they need. I always suggest ask about your medications. What are the side effects? A lot of people don't know all the side effects. This is something you need to ask your doctor, especially if you get a new medication. You want to know, how is this going to affect me, my body, my balance? Is this going to put me at a higher fall risk? I don't know if you've seen the drug commercials. There's that little disclaimer on the bottom that nobody can really read, and those are all the effects of the drug, right? And they make it very small, and you really have to pause the television and get a magnifying glass to read what that is, right? So everyone's got to do their homework on what side effects are for drugs because it could put you at a higher risk for falls, and you would want to know that, right? To be safe. Also, asking a lot of questions. I'll tell you right now. I have friends who are primary care physicians. They are overwhelmed and overworked. They're one patient after the other. They're allotted 20 minutes on average per patient. So they're jumping from one patient to the other. So, it's a quick conversation so you don't forget anything. I always suggest, I tell my home health patients, write those questions down that are very pertinent or write what you want to ask or anything, that you want to discuss and have it written down so you don't forget because the doctor is here. He's got a computer in front of him. He's talking to you. He's looking down. Or he has a scribe that's, if he's lucky or she's lucky, they have a scribe, but it's a quick conversation. So you don't want to miss anything. So I always say, write down your plan, write down all the pertinent information you want to ask. Okay. So what have we left out? Weakness, right? Weakness. And if you're a Star Wars fan, this is where it says your powers are weak, old man. Sarcopenia. Again, this is the word of the day I'm going to mention. It happens and it causes our muscles to get weaker. That's the main takeaway, right? Because we're losing muscle mass. So what can you do about it? Look at this athletic young baby. It's exercise. Exercise is the key to not just older adults, to anyone, right? Because like I said, sarcopenia doubles the time you hit 40 years of age and it triples when you hit 80. So this is an important thing that we need to work on. So why exercise? Well, exercise does a lot of things. It helps strengthen your muscles, of course, first and foremost. It helps strengthen your bones, right? We talked about why someone asked the question about why does it take so long? Because not only are our muscles decreasing, our Bones are also decreasing in density. So we are at a higher risk for our bones to break. And because of that, that causes the decline, right? If we have a broken bone, bodies are healing, but as we get older, it's a slower process, right? And you really need to do strengthening weight bearing exercises, right? What is the best weight bearing exercise for older adults? I'll tell you right now, it's walking. Walking is the best exercise for any older adult because it does the weight bearing, right? Your legs, your feet, you're carrying your body weight, and that's one of the best exercises for you. Even myself, I walk on the treadmill. I don't even run. I walk on the treadmill because it is literally the best exercise that someone can do for weight bearing. Keeping joints, tendons, and ligaments flexible, right? The more flexible they are, the less stiff they are, the less chance you will hurt them, right? And cause issues with, tears, breaks, sprains. It helps increase energy. It helps strengthen your heart and lungs, right? Because cardiovascular health is very important for longevity, living longer and living more independent lives. It helps promote a sense of well-being. I don't know if you've ever exercised and felt it's almost like a high. You feel better about yourself. You feel good. It helps improve balance, it helps improve sleep, and it helps increase your appetite. So these are all the positives of exercise. Words of caution. So if you are new to exercise or if you haven't exercised a lot in your adult life, if you have if you go to a gym, I would consult with a personal trainer. A lot of my own parents, they go to a gym and they have a personal trainer, and it's somehow covered through their insurance. And so, look into that, look into your insurance and see if you have anything like that. Also, for therapy, just myself and other therapists, we create an individualized plan for you because you are an individual. You are not like anyone else. So you have an individualized, tailored plan for your specific needs, your specific issues, and what's going on. Because no two people are the same, right? No two people are dealing with the same things. I always say follow up with your therapist and physician. Always ask your doctor, is it okay if I start exercising? Is it okay if I join a gym or get therapy? Because they will let you know because they know your history. They know what's going on. They say maybe take it easy, ease yourself into it. They'll have recommendations for you. Of course, cause no harm. If you're having any pain, I would stop immediately because if you kind of work through the pain, we've seen this with some older adults and adults, they cause more harm. And now they need therapy, they need surgery, things like that, due to like a shoulder, rotator cuff injury. So you want to take it easy, ease yourself into it. Always check your vitals if you're having issues with blood pressure. You want to check your heart rate. That's something simple to do before exercise. And then watch for any signs of distress, right? If you're sweating a lot, if you're feeling faint, if you're feeling dizzy, you want to stop immediately and go slow. It's not a race, right? The tortoise and the hare, right? The tortoise wins. So you don't have to race. You don't have to go quickly. Take your time. Some of the exercises you can do at home. Bridging. This is if you're laying in bed, you bend your knees and you lift your bottom off of the bed and then back down. It's easy exercise that you can do at home before you get up. Knee extensions. This is bringing your knee to your chest and then straightening it. And then heel raises. When you're standing, raise the back of the heels up and down. Occupational therapy, you could do hand exercises, simple things like opening your hand, closing it a few times, 20, 25 times. We have TheraBands and PNF exercises where you use your body weight. But these are specific examples of therapy that you can do. So things to keep in mind. You want to keep yourself healthy. How do you do that? You monitor. We talked about water. Water intake is a big thing because a lot of older adults, they tend to be more dehydrated, right? Are you sleeping enough? I know sleep is one big thing that bothers many Americans, right? Whether they're an older adult, younger adult. So this is something you want to talk to your physician about. Is there anything that can help? Do you need a sleep study? Because as we grow older and as you know, um, our needs change. We put on a little extra weight. Sleep apnea is a big problem now, and we have solutions. There's a CPAP machine that can help you with breathing. That I know a few friends of mine who have gotten a sleep study, gotten the machine, and they say it's night and day. It's more restorative sleep that they're getting. They're not getting this interrupted sleep and always tired. Also, mind your body mechanics, right? You want to make sure that your you're using proper body mechanics. This is something that therapists teach their patients all the time. And then know your own strengths and your abilities, and don't try to push yourself too much, right? Because we want to improve, but we don't want to cause any harm. And then this is a little bit about outpatient therapy. This is specifically what Rehab Max does. We do a comprehensive head-to-toe assessment, right? We ask, the evaluation is myself as a therapist getting to know the patient, getting to know your routines, your habits, your what's bothering you, where is the pain, what do you like to do, for work, or what do you like to do? What do you do for work? What do you like to do for hobbies? How does that your current diagnosis debilitate your everyday activities, your hobbies. And then we go into specific factors. If you're having rehospitalization, if you've had falls, and then we work on goals. And we always promote making goals with the patient in mind. So we will ask you, what would you like to work on? What kind of goal would you like to set for yourself in the next 4, 5, 6 weeks? Good morning. It's just and then we work on exercises, strengthening, coordination, balance, and walking. And then I always recommend, like I said, with a physician, you want to talk about therapy and if that can help you. And we do home health therapy where we can come to your home. We do outpatient at home. That's a new thing where we can come. If you don't need any nursing, a therapist can come to your home and provide physical therapy for you, or occupational therapy, or speech therapy at home. And then something doesn't have to happen to you in order for you to receive therapy. Therapy is all about preventative care, right? We want to prevent an issue from happening, prevent a fall. So we want to work on your strength, your balance, your coordination, your ambulation. We kind of work and hone in on these things so you don't have these issues. And then these are the disciplines: PT, OT, ST. So physical therapy works on ambulation, strength, balance, getting out of bed. And then occupational therapy works on everyday activities, your strength, your everyday activities, such as like dressing, grooming, bathing. I'm sorry, give me 1 second. So what we provide is physical therapy works on, I kind of mentioned, your strength in your lower extremities. It works on getting out of bed, getting into a car, transferring from a wheelchair to the bed or to another surface. They work on your coordination and mobility. and they'll help teach with assistive devices, or if you're using a wheelchair, power chair, they do all of that. Occupational therapy, there's a little bit of overlap, but we focus on everyday activities like dressing, grooming, bathing, um, housekeeping tasks, right? Groceries, like how to navigate different environments. And then speech therapy works on cognition, memory, cognitive independence and abilities, and also swallowing, because swallowing is a phenomenon where as we age, right, our bodies are aging, and sometimes people have difficulty with swallowing. So they work on exercises with that. And then when to consider therapy. So, like I mentioned, you don't have to have something happen to you. Therapy is also preventative. Like I mentioned, a lot of these orthopedic surgeons are now asking patients to get therapy before surgery and after surgery, right? So, just as uh, it helps to promote the healing and the rehabilitation phase where you're recovering faster. But if you've had a decline in function, where you're having trouble doing your everyday activities, or if you've had an illness or a hospitalization, of course, that's a reason to get therapy. Increased reliance on caregivers or decreased independence in any aspect of your life, whether it be mobility, your self care, your everyday activities of like groceries, housekeeping, taking care of pets, even, right? Um, and then if you've had any safety issues, falls, decreased energy, respiration issues, and then if you've had a recent neurological or orthopedic condition that impacts your mobility or your everyday activities. And the biggest one is pain management. We are a non-invasive way, invasive meaning surgery, medications. We are a non-invasive way of dealing with pain. So we have things like ultrasound, electrical stimulation, laser therapy. So we have these modalities that we use to help with pain management. And then these are the type of treatments that we provide. So we do exercises, balance training, we do manual therapy. This is like a manual massage, but we go to school to learn these specific techniques. We do respiratory training, gait training, which is a fancy way to say working on your ambulation, walking, your safety with that. ADL training, this is your everyday activities, such as dressing, grooming, bathing, hygiene. Transfer training, this is getting from one surface to another. Like I mentioned, speech therapy and occupational therapy work on cognitive therapy. And then pain management. So here's some other things your therapist can do. We can help get you DME and equipment if we so deem you needing like a wheelchair, a walker, a rollator. We do home safety assessments, like I mentioned, right? Where we kind of survey your home layout, and we kind of make recommendations on what we think would be beneficial for your specific needs. We help decrease hospitalizations. We educate you on proper body mechanics. We work on low vision adaptations, and we help decrease fall risk and educate you on your disease management. So these are all things that are in our realm of treatment that we also provide with education. And here's some words of wisdom. So movement is life, so don't stop moving. If exercise could be packaged into a pill, it would be the most widely prescribed and beneficial medicine in the nation. And this was by the Aging. This is how important exercise is because, like I said, everyone look up the word sarcopenia. Sarcopenia happens to everyone as we age. And how can we help slow it down or deteriorate the effects of sarcopenia? It's exercise.